our topic tonight is natural brain support for ADHD.
Yes. So we want to welcome to everybody to the Med Matrix Method podcast, where 1 to 2 times a week we talk all things functional medicine and how to take a more personalized, preventable approach to your health. And as Dr. Rose said, we're talking about ADHD today. I get this topic a lot. Not maybe so much about patients directly. Well, a lot of times patients, but patients will ask about their kids a lot, or
Mm-hmm.
like, my kids and my kids' friends and things. So um, we can begin by just introducing for those that are listening who are maybe new to the podcast. I'm Colin Renaud. I'm one of the lead clinicians in the practice. My background is pretty diverse. I have a background in chiropractic medicine and natural medicine. I practice medicine at MedMatrix as a PA. I'm board certified in multiple disciplines, including in anti-aging, and I'm fellowship trained in functional medicine. And I think between Dr. Rose and myself, we have over 30 years of functional medicine experience. So I think we do pretty good, right? So I'll let you introduce yourself next.
Yeah, my name is Dr. Sasha Rose. I'm a naturopathic doctor. I'm a licensed acupuncturist. I am as well one of the lead providers here at MedMatrix. And I've been practicing functional medicine for over 20 years. One reason that I really love having the opportunity to do this podcast is because it really does let us kind of dive into some of these very common topics. So, for example, ADHD, again, as Colin said, it's often people bringing it up about their children. But what I think is maybe a different angle, or especially interesting about today's episode, is that we're mostly going to be focusing on ADHD and adults, and
Yeah,
that's kind of deserves its own time and attention.
yeah. So, a couple of housekeeping things before we start. As I said, we stream our podcast 1 to 2 times a week live, and then we are also available for streaming later on Spotify or Apple Podcasts. We take questions during our live stream. So if you have questions, drop them in the comment box. If you're listening on YouTube or on Instagram, just drop them in the comments. And we want to offer a medical disclaimer that this podcast is for educational purposes only. Dr. Rose and myself like to talk all things healthcare and longevity and wellness, but this is not meant to be nor to replace any medical advice. If you're seeking medical help or attention, please refer to a physician. If you are interested in giving us your medical advice, you can become a patient though through MedMatrix, and we'll talk about that later towards the end of the podcast, how you can do that. So to start us off, Dr. Rose, you mentioned this very briefly, but with ADHD, a lot of people think about this as really children, a children's problem or attention deficit issues and kids that struggle with learning or behavioral issues in school. But I think it's really important that we talk about this not just from a child's perspective, but as you said, just a personal perspective from an adult or anybody. And many people think ADHD is really just a brain issue, like with attention, you just don't function properly, you're not behaving well. But I think it's important that we talk about what actually goes on in the brain, like why this is actually a thing, sort of what the stigma behind that, so we can sort of get rid of the stigma. What are your first thoughts when you think about ADHD or educating a patient about what this actually means clinically or scientifically?
Yeah, I think it's a really good question because I think, as you mentioned, people think of ADHD as only applying to children. The H is in there for hyperactivity. So people kind of think of, the child who can't sit still in a classroom. And I think for a lot of adults who are dealing with this, they most likely were also dealing with it as children. And there, unfortunately, in our culture right now, there is, I think, a stigma that gets attached to it sometimes quite early on. And so when I'm seeing my adult patients, there's often some shame that comes along with it, and sometimes even maybe some hesitancy to kind of talk about it, or just like it unfortunately can kind of translate into an individual not feeling smart, not feeling intelligent, and that was potentially kind of baked in early on. And so
Yeah.
it's really not I think a part of our role, I don't know if this is your experience, but I feel like, we do talk about being educators. And I think some of that is kind of doing what we can to peel some of that stigma away and some of that shame away, and really just get into kind of the nitty gritty on executive function and attention regulation and the neurotransmitters that are involved, the prefrontal cortex, and kind of just talking about it just as like a, it's kind of a neurotransmitter issue. It's kind of a executive function issue. It's not inherent intelligence or lack of.
Yeah.
Tell me how else you talk to your patients about it.
I was going to say, I think the way you explain that is really important because when I think there's this almost inherent feeling because of potential stigma. There are certain things in healthcare that are very stigmatized. Certain disease processes, STDs are very stigmatized, or obesity can be stigmatized or whatever. But when we think about something like a brain chemistry issue, there is this stigma, and you said it beautifully of like, well, they're not as intelligent, or they lack maybe willpower, or they weren't raised right or something. If kids that are hyperactive, it's like, well, the reflection of the parents or something. They're not raising their kids the right way or something. But it's really important to, I think, for my patients, and I'm seeing this a lot more in my adult patients where they are getting ADHD diagnoses, but they're seeing a specialist, and um, there's almost this affirmation that they feel,
Mm-hmm.
sort of to say, well, I'm I'm not stigmatized because I knew something was sort of wrong with the way I perceived certain thoughts or the way I handled myself, and I feel almost validated that I can use this as a way to understand myself better. So I really think it's important when patients do hear it and understand it, and that's how I try to talk to people about it, is really from a validating perspective of saying, okay, how do we understand how you learn? How do we understand how to treat you better? Um, so it sort of is a better way, I think, for us as clinicians to better direct care to, if we can understand this about our patients. And I think it's also really important to distinguish what that means for patients, like symptoms wise, because certain symptoms show up differently in children versus adults, and this can be very relatable to people because it sort of broadens that validity. Like I said, if we can understand what the symptoms are, then you can sort of understand how it applies to you. So I think some of the examples of that really with the symptoms is, hyperactivity in children. Uh, a lot of times I see, and I have this myself a little bit. I've never been diagnosed with ADHD, but I think probably all of us have some sort of spectrum of attention issues. In the advent of cell phones, right,
Yeah, right.
and technology, we all have short attention spans. But most adults I see, they have this internal restlessness kind of thing. And I can relate to that. Brain fog can be a big thing for adults, feeling overwhelmed. And then also feeling very emotional, or emotional sort
Mhm.
of reactivity, or emotional highs and lows I've seen in some of my patients. What are your thoughts there with symptoms with children versus adults? Do you see differences?
Yeah, I mean, I think ADHD can present differently. There's obviously some commonalities, but some differences between children and adults. I think, like I kind of gave that example of a child having a hard time conforming to the traditional school structure, having to
Mm,
be physically still day in and day out. And that with, I would say, most of my adult patients who either have a diagnosis of ADHD, or whom we suspect that they might have ADHD. As you said, it's a little bit of that short attention span, kind of more of an internal restlessness than external. Um, and I was going to say brain fog and overwhelm, which, as we will talk about, and we have talked about a lot, is kind of other things that can influence things like brain fog and feeling overwhelmed. But one piece that I find really interesting, and I have this one patient in particular that I'm thinking of who used this term, which is time blindness, and she
yes.
described working She loves what she does. She has a corporate job. She works a lot. And she has figured out a way to basically partially manage her ADHD in that she will set alarms and, post-it notes, alarms, basically telling her it's time, you have to get up, you have to work, you have to stop what you're doing and move on to the next task. Because if she doesn't, she literally has no idea if it's been 15 minutes that she's been working on this
Oh,
project
wow.
or 3 hours. It's like
Wow.
she has no internal perception of that. And it just stuck
Wow.
with me, her description of that. And she herself used the term time blindness. So
That's very interesting. I
yeah,
love that.
yeah,
Yeah. And because I
yeah,
think we all have that sense of
sure.
some, and if it's an ADHD thing or not, but I feel like that's why something like this could be a spectrum for maybe anybody in some way, because if you think about it, we could all get lost doing something
Mhm.
in some way, right? People who work like all hours of the night or whatever,
Right.
and they don't sleep, or but I think if it's disrupting your function day to day, that's really really a struggle. That's really interesting. Um,
And for her, I think interestingly, even though she was like diving really deep into one task, it was impacting her quality or her productivity of work because she was not completing other ones, right? So she
right.
was kind of you could say time management, but for her, it was really specifically this kind of time blindness.
Yeah, it's almost like you become unconscious
Mhm.
and the whole world disappears around you and you're just so focused on what you're doing. So one of the couple of the other things I think that are really important as we introduce this topic and get into it is really what's the cause of this. I think
Mhm.
that's where most people try to understand, and I think that's really the important part of the stigma piece is if we can understand what some of the root causes are. And from a functional medicine lens, right? We're functional medicine practitioners. We don't look at this as, oh, you have ADHD, so you need a stimulant. You have a stimulant, deficiency. It's not a thing. Ritalin deficiency is not a thing. So Adderall deficiency is not a thing. So when we talk about functional medicine in regards to root causes of ADHD, things that I see a lot are a lot of lifestyle things. I don't know if this is what you're seeing, but I see a lot of issues with sleep or anxiety or nutrient deficiencies, stress, and I mentioned earlier these things we have, in front of us all the time. And I even find myself, I'm on with a patient sometimes and my phone and it's like it dings. It's like, oh, an email. Oh, what is this? It's like, just don't worry about it. It's fine. It's not important. Back in the day, we checked email when you were at a computer, right? Or a voicemail when the phones were plugged into the wall. If you were gone for the day, you didn't get a phone call because we didn't have phones. You had to check your voicemail when you got home. But we're so tuned in. So I think that has really changed our brain chemistry significantly, is this overstimulation that we have. But I also see issues with like gut
Mhm.
dysfunction, hormone dysfunction. What are some of the things you see in relation to ADHD as root cause potential?
Yeah, like what are some of those root causes or factors that can worsen ADHD, and maybe what, from a I guess what I would say from a neurotransmitter standpoint, I think we're mostly dealing with kind of dopamine and norepinephrine, and it's not.
And what are those for
Yeah,
people
so
that are
those are
listening?
neurotransmitters,
Okay.
primarily in the brain, although they are also kind of produced in the gut. And usually what we see is when there's like a signaling issue with those neurotransmitters, kind of the individual's not necessarily getting the full benefit of those neurotransmitters, and that can lead to kind of I think of it in terms of that stimulation. Like I think of it in the terms of why do these medications that are stimulants, why are those working? Because they're kind of taking the place of what those our own inherent neurotransmitters, mostly dopamine and norepinephrine, are doing. Those are stimulating. They're kind of like feel good and
Hmm.
motivating neurotransmitters. And so when there's kind of a disruption in the signaling and in the pathways of those neurotransmitters, and a lot of the things that you just mentioned can impact those, everything from hormonal health to gut brain axis to nutrient deficiencies, all of that. then you're not really getting the full benefit of those endogenous or your own neurotransmitters. And so what we're hoping to do from a functional medicine perspective is look at the whole person, look at all of these different pieces, nutrient deficiencies, hormones, stress, screen overstimulation, as you've put aptly, even thyroid, like looking at all of that and to see, well, where is the issue with this neurotransmitter balance? Where can we kind of support the whole body? And if necessary, yes, there are these medications out there, but really trying to do more of, what we do best, which is root cause medicine.
Yeah. Do you think that as I don't want to say that we are getting we're not getting I don't want to say we're getting unhealthier as a society as time goes on, but sort of in a sense a little bit. Do you think that ADHD is becoming more, I know your answer to this, but I want the audience to hear your answer. Do
I'm
you
just going to
think
sit back and let you
ADHD,
give my
no,
answer.
do you think ADHD is becoming more prevalent in our culture and maybe more recognized? I mean, there's more diagnostic resources and things, but as we become more and more maybe dysregulated as
Mm.
a human species, right? Hormone dysfunction and blood sugar regulation and gut issues. Is that why we're more ADHD, do you think? I do. What do you
Yeah, and I
think?
think it's a good question. Is there societally, is there a rise in ADHD? And I think it's probably both. I think that there's both more of a awareness of it, a recognition of it, hopefully in
Mhm.
both children and adults. And hopefully we'll get to a point where it's less stigmatized, but just more of an awareness of it. But then I think, as you said, I mean, we're all guilty of that kind of like super short attention span. And I feel like I used to have the capacity to kind of, read a whole chapter of a book. And now it's like, it feels like a struggle. It feels like an internal struggle to
Same.
not take a break and check my Instagram feed in the middle of reading a chapter. I mean, that's ridiculous. So I think you kind of have to be living under a rock a little bit to not be somewhat affected by by how media,
Yeah.
social media at least, has kind of impacted us. So I think both things have happened, the kind of the diagnostic, the awareness of it, but then also, unfortunately, everything that you mentioned in terms of exacerbating, contributing to a rise in that kind of attention dysregulation.
Yeah, we're just like becoming different as humans. I think the way we operate and the way we live. So it's making this behavior, I think, more prevalent for people. For those that are listening live, we thank you for being here. If you have a question, you can drop it in the comments section. If you're on YouTube or Instagram, we will answer questions toward the end of the podcast. So drop us a question. Dr. Rose and I would love to hear from you. So I want to move on to another really important uh, piece of this puzzle that I think I see really often is blood sugar issues that can affect people's mood, their focus. They get tired during the day, right? They don't eat a good lunch at work and then they're falling asleep at their desk at 2 o'clock. Or they haven't eaten breakfast. They eat a muffin for lunch and they're totally asleep by, on their ride home from work or something. So this, I think, is a really, really big topic when I'm talking about attention issues or focus issues in my patients is blood sugar regulation and how spikes and crashes in people's blood sugar, which could be related to diet or other metabolic dysfunction, can really lead to a lot of inattention, a lot of irritability. Um, People that are eating, like I said, really bad food choices for big meals, processed foods, simple carbs, a lot of sugar. So I'm assuming you see this all the time in terms of metabolic dysfunction, poor
Yes,
diet
absolutely.
relating to cognitive issues.
Yeah, what we can probably, just by being with somebody for a brief amount of time and learning about what they are eating or not eating, what their meal schedules are like.
Yeah.
Absolutely, I think blood sugar is a huge part of it. It just makes like attention and executive function and mood kind of stabilization so much harder when your blood sugar is just, I guess, to overuse the term, kind of dysregulated. And I think that it does become this vicious cycle where somebody's energy is tanking and they go through the Starbucks drive through and they get one of those. It's not a coffee, right? I mean, it's like, I don't know the amount of sugar that's in those, but I mean, I understand it. Like, you're tired, you don't have time, and it's available. And so you get a huge frappuccino, whatever, with lots of whipped cream and a couple shots of this and that, and you feel better, right? Like, there's your glucose hit. That's feeding the brain, and you feel good and you feel like you can focus. Or there's also energy drinks, which can kind of, maybe not impact your blood sugar, but definitely kind of give you that shot of energy, and that you've got that spike and then you crash again, and it's just up and down. It's like, so you're kind of inadvertently trying to manage it, but you're really just having these big highs and lows. And with that kind of that volatility, it just makes all this kind of daily functioning that much harder. And so, kind of what you alluded to, it's like, if somebody's going to get one thing from this podcast episode, ideally it would be eat a breakfast that has protein in it. Like, eat something that's not just processed carbs. Start your day like that. Just that.
I mean, the thing I think that can confuse people is, like, glucose is the main nutrient for the brain, but that doesn't necessarily mean eat sugary food.
Straight up sugar.
Yeah, straight up sugar is not the answer, but having this dysregulation in your blood sugar is really what we're talking about, and how it can improve or sort of totally out of whack your focus. So I think that's a really good point. And I do see, I mean, I don't know how many patients I see at a time where there is metabolic dysfunction, insulin resistance, pre-diabetes. It for a lot of my new patients, and you would probably agree, it's a lot. There's a lot of people. It's not everybody.
Diabetic range, it's pretty common.
Yeah, it's really common. And when we think about how that can affect overall, like, mood, focus, it's probably a lot of people, a lot more than we think. So as we talk about this from almost a food perspective, talk about what not to do, what should we do? What are the most important things that we can naturally support, being calm and cognitive performance and just ADHD in general? I mean, there's tons of studies that I've seen that are really identifying food and nutrients as extremely important factors of brain cognition and ADHD. Magnesium, omega-3s, zinc, B vitamins. You mentioned protein. I think protein is really one of the most important things you can do for your body. And I'm really excited to see that a lot of people in the media and the mainstream sort of knowledge about food is, wow, I need to be eating more protein. I don't love that big food companies are putting protein in, like, pasta to make it sound like it's healthier. It's not. But hey, at least the conversation is starting, like, okay, protein is really important. So do you have any, like, aside to things I was mentioning, do you have any specifics that you're educating people on or putting people on with a nutrient, from a nutrient perspective, with ADHD or cognitive dysfunction?
Yeah. So I guess, like, if I'm trying to simplify it, make it something that somebody can actually do, and they don't feel like they have to kind of overhaul everything that they eat. I would definitely agree with you in terms of, the actual, nutrients being what you listed there in terms of the omega-3s and magnesium, et cetera. One thing that in terms of stabilizing blood sugar, both protein and I would also include in that some healthy fats. When you add that to carbohydrates, you're lowering that volatility of blood sugar. So if you're, the example that I always give is, if you're going to eat an apple, have a little bit of cheese or a little bit of nut butter with the apple, because that absorption of the glucose from the apple is going to last longer. You're going to kind of get more bang for your buck. It's just you're not going to have, not that an apple is going to give you a sugar high, but, as an example,
it might, certain people,
maybe for some people. So you're going to get, like, your energy is more sustained.
Yeah.
just by adding in a little bit of healthy fat. I'm not asking anybody to go out and eat onion rings, but I think healthy fats are often kind of underutilized.
Yeah. Yeah, put some olive oil on something, or
Sure.
like,
Yeah.
a nut butter, or a slice of avocado,
Yeah.
something,
Yeah.
you know. Yeah, I think what I try to educate a lot of my parents that ask about ADHD, because we don't, at Matrix, we're not treating children under a certain age. So we do have a lot of parents that come to us for their own health issues, but they ask about their children, and, oh, is there, can you comment on this or whatever? Just in my career, I've seen parents with children and families, and there's always this overwhelmingly obvious nutrition issue in
Yeah.
kids. And the research is overwhelmingly supportive of nutrition drives cognitive function. Like, oh my gosh, so kids nowadays are just eating so much food, quote unquote. It's not really food, it's like a food product.
Yeah.
Things from boxes, then cookies that have a superhero on the box, so that's why they buy it, or it's a TV show or something. There's so much non-food food that children are eating, and that is becoming overwhelmingly clear that that's driving cognitive dysfunction in children and ADHD. So the nutrition part is really, really important. And I think from a practical perspective, that's where I always start when I
Absolutely.
do these things. I'm sure you would agree. I mean, with patients, even if they have a blood sugar issue or a hormone issue, even if it's any issue, right? ADHD or brain fog or I can't sleep or whatever, we have to talk about the food, right? I mean, it's imperative for success. I think you would agree.
Absolutely. Yeah. So just while we're on that topic, why don't you dive in a little bit more into kind of that gut brain piece? And so
Oh,
including
sure.
nutrition, but just kind of like the microbiome, neurotransmitter production, like talk about how all of that works together.
Yeah. So you mentioned this earlier about, some of the neurotransmitters, these chemicals in your brain that make you feel good. A lot of, there's a lot of production in the gut. Most of our serotonin is made in the gut, which is many of your happy chemicals that makes you feel good. So this is an excellent sort of, from a functional medicine perspective, the relationship of the gut to how you feel mentally is really well understood and really well researched in the literature. And this is where I think functional medicine, one of the highlights of functional medicine is we as practitioners understand this relationship really, really well. So we can really dive into some specifics about how the gut affects the body overall, whether it's cognitive or ADHD or something else. So the microbiome, or the buildup of your bacteria in your gut, sort of your garden in your gut, is really linked to how your neurotransmitters are produced, how much inflammation you have, and also sort of signaling from the gut to the brain. We call it the gut-brain axis. So there's inflammation in the gut, things like leaky gut or intestinal permeability, infections, bacterial overgrowth, a fungal issue, a parasite. All this causes dysfunction in the gut, inflammation, which leads to the signal from your gut to your brain being compromised, where there's inflammation in the gut. It's sending a signal to the brain to be inflamed, and it goes back and forth, on itself. So we see neurobehavioral changes with very poor gut health all the time. And there are studies that show that certain bacterial strains in the gut can be related to certain neurocognitive behaviors, certain autistic behaviors, or um, certain types of behavioral issues and aggression and mania, depression, anxiety. So there's a really, really important connection there. And this is a great way to understand what root cause medicine really is from a functional medicine lens, right? If we're looking here, like the problem is here, but the solution is here, that it really takes a very seasoned person in this field to understand that connection, right? Your average, say, conventional medical practitioner may not understand the relationship, and that might be the reason that the patient is not feeling well. It's a really, really good point. Do you have any thoughts about that? Did I miss something? Do you have any
I
other?
think you said it really well. I think we've talked. I think a lot of people may have heard the term leaky gut. Um,
Yeah.
But I think that's another kind of link when there is a level of increased permeability in the gut lining. And so when that microbiome is off, when kind of that garden, as you put it, is kind of not so great, the soil's not so great in that garden, there's increased gut permeability. And so it's basically, the theory is that it's the start of inflammation systemically. So you're basically triggering an inflammatory response starting in the gut, but that then can go, throughout the body. So, and that I would include the nervous system in that. I would include things like brain fog and fatigue. And that can be a little bit, there's so many things that can contribute to that, but we do know that brain fog and obviously inattention are like a big part of ADHD. And I would put that in kind of that potentially that leaky gut inflammatory connection. So another way to view that gut brain axis.
Yeah. I was just going to say, have we done a podcast on leaky gut? If we haven't, we should.
About time.
It's about time. I was just thinking, like, we've done so many, I can't remember.
Yeah,
but stay tuned. We'll do a podcast
on leaky gut. Absolutely.
We could do a whole series like on, leaky gut, how the brain gut connection, whole thing. Well, stay tuned. We'll do that. Not to shift gears, but another really important topic I think we need to address on this podcast in particular when we talk about ADHD is the role that sleep plays. We talk about sleep all the time on the podcast. We've done episodes and galore on sleep, and how sleep is so underappreciated. So sleep is, and I actually just had a patient yesterday who sleep and insomnia is like the chief concern. And it's almost as if, well, I can't even move on to other things because if you don't sleep, I don't really know. We've got to figure that out first. We can do the this and the that and, all these other things, but sleep is so critical. Sleep is really how your body recharges and regenerates itself. So sleep deprivation is known to cause a worsening of attention, and it affects your circadian rhythm. It affects impulse control, and it affects that neurotransmitter balance that we've been talking so importantly about. So, and I know we had a whole podcast on the glymphatic system, which is really this part of the brain that cleans itself, right? It's the waste product, the waste plumbing of the brain to clean itself. So when we talk about sleep, this is day one. This is like when we go through the medical history, what's your diet? Do you drink alcohol? Do you smoke? All right, how do you sleep, right? Is it good? Is it 8 hours? Are you rested when you wake up? Do you track it with your little ring or an app? I know you track yours, Dr. Rose. You're big into that. Your family does the whole thing with the sleep tracking. I know you guys love that. So it's such an important piece of things. And when you introduce this topic with patients with cognitive dysfunction, brain fog, ADHD, how do you start? Like, how do you get going with a patient with education on sleep? Where do you intervene first? How do you make this happen when this is such a prevalent issue with these types of patients?
Yeah, I would agree that sleep is more often than not, I guess, suboptimal, we could say, with people who are dealing with ADHD. And unfortunately, it is commonly overlooked. I think some of it can tie back to some of those other lifestyle pieces that we were alluding to, where people have become, again, oftentimes with ADHD, they're kind of, somebody is looking for ways to be stimulated, right? They're looking for stimulants. And so there can be this reliance on caffeine, on sugar, maybe even on over exercising for some people, but some, and so if you spend all of your waking hours kind of over caffeinating, too much sugar, it's not like you magically are going to be able to get to 10 p.m. and just lie down and have a deep, restful night of sleep.
No, it doesn't work that way. Are you sure?
That way. No, you have a patients where that's their experience. So, so a lot of it's tied into that, and then just that, like we mentioned at the start, that kind of internal restlessness. Like sometimes when we talk about sleep hygiene for people, that doesn't come easily to somebody who's dealing with ADHD, right? Like that just kind of ability to slow down, put the screen away, that is not so easy because they've been revved up all day. But yes, I think kind of whether it's working with kind of these behavioral modifications, again, back to the nutrition, whether you're, using a wearable to kind of track your sleep. But I think it's not as you do, right off the bat, the first visit, you're talking about sleep. My experience is that it takes time, and it takes commitment on the part of the patient, of slowly kind of figuring out what is going to work. It's not like I'm handing somebody a magic pill for their sleep. It's just not the way that you and I practice to give somebody a sleep medication and just say you're good. Like that's not necessarily root cause medicine. So I think acknowledging the role of sleep and figuring out for that individual how to optimize sleep. And then once that happens, it really is like a gift to the nervous system. And when we're, overall, we're trying to regulate the neurotransmitters, regulate the nervous system. And as we have said in different ways on different episodes, like sleep is crucial to that.
Yeah, I think you said it really, really well to sort of say you can't like we say all the time, you can't out exercise a bad diet to lose weight or other body goal, but you can't really ignore or medicate good sleep. And if people are uninterested in recognizing that, it's almost like the buck stops there, essentially. Like we have to do this. And I think it's so under recognized in terms of the importance of not just only cognitive or behavioral function, but just how you exist in the world, your mood, or it affects your blood sugar, your ability to detox, your gut health. I mean, there is so much regenerative properties going on there. So I think we've, again, sort of with the phone thing that I was talking about earlier, we have come to start to live in a world where, oh, I don't need a lot of sleep. I can just do it. Or, people that are really, really high level achievers, and achieving at a high level is not a bad thing. I mean, you and I do, we try to do that, that's part of, being a professional or something, is achieving high level. But there's this level of like overdoing and underdoing certain things to keep you healthy. But I do think there was a silver lining to the COVID pandemic of, oh wow, I don't sleep, or I have way too stressed, or I don't take care of myself. So I do think that people are starting to recognize some of these lifestyle things as being really important. You mentioned, like, from a root cause perspective, as clinicians, our job is not necessarily, oh, you don't sleep, here's a sleeping pill. But are there, not that there's anything wrong with that, but it's just not necessarily our style all the time. Are there natural things or sort of supplementation protocols that you love? You have a huge background, as do I, in natural health care and using supplements and herbs and botanicals. Are there certain things you go to, like right off the bat, to help people with attention and supporting emotional regulation? What do you like that you use for people?
Yeah, there's a number of botanicals and micronutrients, minerals, vitamins that I've seen work for people with ADHD. The goal with any of these would be supporting the nervous system, supporting the adrenal glands, and kind of overall helping with both attention and ideally emotional regulation. As we always say, it's a very personalized medicine. So depending on how it's really presenting for a specific patient, if it's difficulty falling asleep, we might focus on certain things. If it's more of, it's impacting my executive functioning at work, whatever, that will tweak kind of which individual products I'm going to recommend. But in general, and without giving actual medical advice, L-theanine is a really great amino acid. It's really great for sleep. It's really great for anxiety. That one's a favorite both in children and adults. Some of the botanicals would include lion's mane, maybe passiflora, rhodiola.
Passiflora.
And then phosphatidylserine is a really good one. That one is one that I've actually used with some patients who are trying to wean themselves off of Vyvanse or Adderall. So I've had some good results with that one. And then, various forms of magnesium, usually threonate or glycinate are usually the ones that I start with. Do you have some favorites for this?
I love those. I love like a rhodiola phosphatidylserine sort of combo, rhodiola during the day. If there's anxiety, phosphatidylserine, magnesium at night, L-theanine a lot, use that a lot. But to your point, it really does depend on the nature of the cognitive dysfunction or the sleep issue or the inattention. And this is where it's really important to get, I'll sell us a little bit, Dr. Rose. This is
Go for it.
This is really where it's important to consult with a clinician that
Mm-hmm.
has experience from a functional medicine lens, because patients can waste a lot of time and a lot of money, especially nowadays where we talked a lot about social media and phones. You're scrolling, right? And if you
Yep.
don't sleep very well and you're up at 3 a.m., your phone probably knows that. So it's
Oh,
going to
yeah.
give you an ad for something to help you sleep, probably if it's smart, which it probably does. And you buy it. And is it going to help you? Who knows? Maybe. But is it tailored to your concern is really the point that you very eloquently made, right? The issues that we're talking about with cognitive dysfunction, ADHD, or sleep issues, or attention issues, mood issues, all the different types of interventions we use, whether it's a botanical or supplement, it's a specific target. We're trying to do something. So this is where I think people get really lost. And this is where I think there can tend to be issues with, there's a belief that, oh, that doesn't work.
Yeah.
Oh yeah, I
I
tried
tried that.
rhodiola.
I
That
tried that.
doesn't work.
Yeah.
Well, it does. You're just not using it the right way, or you haven't been prescribed the right dose, or it needs to be at this time of day versus this. So this is where I will sell us, right? Because we know, that functional medicine clinicians in this vein do a really good job of understanding the specifics, the what, the how, when, those types of things. We are coming near
I want
the
to
end of
add
the, oh,
one thing to that,
yeah,
again, just to
of
continue selling
course.
us a little bit, is I
Yeah.
think the another way that having a medical professional kind of involved in this is that drug herb interaction
Oh,
piece.
well,
So,
totally. Very good point.
for a lot of these patients with ADHD, they're on maybe, like you mentioned earlier, like a lithium or an
Mhm.
Adderall. And a lot of my patients that are on those have also been diagnosed with something like with depression and or anxiety. So they're also on SSRIs. They're also on SNRIs. And so we have to keep an eye out for things like serotonin syndrome, which
Mhm.
is when there's kind of, too much serotonin in the system. And other interactions that I think it is just in the name of safety, it's important to have some guidance.
So important. That's a really good point. Like claps for that. That's like really, really good point. We are coming up on almost the end of our podcast. We have, a little bit of time left. If patients are or people are listening, patients, maybe our patient. If you're listening to us live on YouTube or Instagram, please drop us a comment if you have a question for us regarding this topic. One more quick thing I want to talk about that I think is really, really important before we get to some questions is when we've talked a lot about different things in terms of root cause from adults to children. We didn't talk too much about hormones. You and I are big hormone people. We do a lot with hormones. We've talked a lot about hormones on the podcast. How are hormones, especially maybe in children, right? Because there's things like puberty and change in secondary sexual characteristics from puberty that can affect children as they grow. So what kind of influence do you see with hormones on ADHD, or if not in children, in adults too, men and women who go through hormonal decline as we age? What kind of things do you see in relation to hormones in ADHD patients?
Yeah, I think I know that hormones play a big role in with adults with ADHD symptoms. I'm going to talk a little bit about my female patients and the hormonal component with them. I'm going to let you, since we've kind of
Okay.
divided and conquered this in the past, let's continue on that theme. I'll let you handle the men and the
The men.
testosterone.
Okay.
Um, So one thing that I find really interesting is that relationship and this does impact men as well, but I'll focus on my female patients, which is that relationship between estrogen and dopamine. And estrogen is basically supports the production and the receptivity or the sensitivity to dopamine. And so there's times in a woman's life when estrogen drops. And so that includes that can drops and or fluctuates. And so that can be sometimes puberty. It can be the premenstrual time on a monthly cycle. And it can be perimenopause, right? And postmenopausal. So those fluctuations, those drops in estrogen directly impact how a female body is receiving and responding to dopamine. And so if somebody kind of has those tendencies anyway, those times in her life are often going to be that much worse. And so you're going to see the things like inattention, the brain fog. Sometimes it can present as depression. It's often kind of misdiagnosed as depression. And one interesting thing, I was listening to a talk specifically about women and ADHD, and this presenter, this medical doctor, was talking about high achieving women who often have ADHD. It's undiagnosed, undetected, and there's a very high rate of burnout in these women because they, one way to kind of compensate for adults, not just women, is often this kind of like very high achieving. But your nervous system, your adrenal system can only do that for so long. And so there's just this kind of disconnect sometimes in terms of what the person's presenting as, but then there's this there's like a diagnostic gap, basically. So that's what I'm seeing. And I just find that estrogen and dopamine connection is really, really
fascinating.
Yeah. So tell me about the men.
Oh boy. So from a male perspective, where our hormones are predominantly testosterone, the male dominant sex hormone, most of what I'm seeing in men is a lack of motivation. And also low testosterone or suboptimal testosterone significantly affects men's mental state, their mood, a lot of depression, anxiety. Could it be attention span and feelings of like internal restlessness like we've talked about? Absolutely. And there's also a very interesting thing I've seen in men all the time, and it's a little bit not quite related, but sort of, is with low testosterone or suboptimal hormone function, I see men have a lack of self-worth in a sense, or like a feeling like themselves, whether it's a self-esteem or it's a just feeling more in tune with themselves, feeling confident. And you could relate that to something like an attention issue or neurocognitive change, because if you feel really good mentally, like really sharp, really, like I could tell a really good joke kind of thing, or somebody says something and you have a really quick response, that's a really quick, almost reflex of the brain, right? Almost like if you're driving and somebody stops short and you're like, oh, I've got to, your reflexes are really good. We have mental reflexes. And I think mental reflexes are significantly impacted by hormone function for men, specifically testosterone. So if our mental reflexes are a little slow, why wouldn't we feel a little bit cognitively declined or brain foggy, or our attention is low and we're looking to our phone for that dopamine hit, right? Something to kind of like wake us up and make us feel good. So I see that a lot in men. And I don't think a lot of men, same thing. I mean, I treat a lot of women too, so I can speak for women too with hormone deficiency, but I don't think men and women with hormone decline really understand that they have this going on until we start to treat them. And then 3 months, 6 months goes by and I follow up with them, and you probably have the same thing. And then they're like, oh my gosh, my brain is firing. I'm thinking, I'm answering my emails. People at work are telling me that I'm on the ball. And you don't really realize it because it's a very slow to start, a very slow to happen kind of issue. It doesn't happen overnight. So I see that's what I see a lot of, is this really, really strong connection in the brain. I guess, Dr. Rose, we did an amazing podcast because no one has any questions. We have one question, and then I want to play a really quick, like 1 minute game to sort
Okay.
of wrap up
Sounds
and highlight everything. So we have one question from online, and it's a really interesting question. Do you recommend breath work to patients who struggle with ADHD? If so, what techniques? Do you have experience with breath work? Do you teach breath work to patients, Dr. Rose?
Yeah, I do have experience with breath work. I would say I wouldn't call myself an expert
No, I wouldn't
in it,
either.
but I have worked with experts and I try to keep it simple. So there's all sorts of different methods. Um, there's, I think, one of the most simple one that I've found to work for myself and for a lot of people is just simply the counting. Like on your
Hmm.
inhale, you count to 4, and on the exhale, you count to 5, and you just kind of focus on that, and it really kind of brings you into the body. And I think that that's largely how, I mean, that's nervous system regulation right there, right?
Yeah.
But I think breath work is good for all of us, including patients, including people with ADHD. How would you
Yeah,
contribute?
there's a one technique that I've learned. I don't remember even where I learned it, but it's counting in four
Yeah,
with breath work. Is this, do you know what I'm talking about?
I do.
So it's and you can use it as a tool for anxiety or panic or, like an acute
Mhm.
situation too. But it's almost like it's an inhale over like 1, 2, 3, 4, hold it for
Pause.
1, 2, 3, 4, exhale over 1, 2, 3, 4, and then pause again, 1, 2, 3, 4. So I think it's called is it box
I
breathing? Is
square,
that
box breathing.
square breathing? Yeah, because you're going like
Mhm.
inhale, stay, exhale, and then you go back around. That is one of the techniques I learned years ago for vagal nervous system regulation. This sort of inherent part of your nervous system that is controlling like your automatic ability for anxiety and feeling overwhelmed. So yeah, I'm a big fan of breath work. So as a wrap up for our podcast, Dr. Rose, I have a really quick, like 30-second true false game,
Let's
giving a really, really quick sort of take home. So true false. Okay. ADHD is just about having too much energy.
false.
Adults can have ADHD even when they're not diagnosed as kids.
True.
Yeah. People with ADHD can't focus.
False.
ADHD is caused by laziness or lack of discipline.
Big false.
Yeah, big false. Um, Everyone is a little bit ADHD.
I would maybe say yes to that.
Yeah,
True.
maybe.
Maybe.
Yeah. I guess it goes back to it's about severity and level
Yeah.
of impairment and things. Yeah. ADHD can affect sleep patterns.
True.
Medication is the only treatment for ADHD.
False.
I was going to say, I hope if you took home anything from this podcast, it would be ADHD can impact emotional regulation.
True.
People with ADHD are less intelligent.
Big false.
Big false. And then ADHD brains respond differently to dopamine.
Maybe true.
Yeah, I think
Yeah.
that we sort of
Yeah.
talked all
Yeah.
about that. So, um, for those listening live, we thank you so much for your attention. This has been really, really fun. Dr. Rose talking all about this. I think this is
Mhm.
a really, really important topic. So, for someone that is struggling with focus or they're overwhelmed or they suspect they have ADHD, um, how can MedMatrix support them? How do we, as functional medicine clinicians, just in like 30 seconds, what do we do that's different from other people that we help people with these types of issues?
Yeah, somebody struggling with overwhelm, they suspect or they know they have ADHD. What are we doing to kind of support
Mm,
neurologic function, brain function? Kind of like we do with pretty much any case. We're doing a very comprehensive health history, symptom history. We're doing nutrient and metabolic testing. We're always looking at thyroid and hormone uh, baseline levels. We're looking at gut health, and that's both just from a the intake conversation to advanced testing. We're looking at gut health, as discussed today, working towards sleep and lifestyle optimization. Again, as mentioned, very personalized supplement, nutrition guidance. And I think, as we said earlier, like if somebody's going to take anything away from this, like look at what you're eating for breakfast, focus on protein, focus on healthy fats, do what you can to stabilize blood sugar, and overall sleep hygiene, just kind of looking globally at the issue, not just it's just about focus and it just needs the right medication.
Right.
So yeah, looking at root
Yeah.
cause, looking at somebody in a very comprehensive manner.
Yeah, I mean, I think the take home really that's important to note is like ADHD is not a lack of potential. It's not a
Mm-hmm.
lack of intelligence. It's not that you're, not to a certain level of intellect or something like that. It's really the brain needs the right things to function, the right environment, the nutrients, the hormones, the gut health, everything to perform at its best. So I want to thank everybody for tuning in. If you've been here with us live, we thank you so much. If you're listening to us somewhere in the future, you can find us on Spotify and Apple Podcasts to stream. We do 1 to 2 podcasts a week where we focus on all sorts of functional medicine and health topics. If you are interested in becoming a patient of either myself or Dr. Rose or one of our other really seasoned clinicians, I think there's 6 of us now in the clinic. We have a great team. We see patients in Maine and New Hampshire only right now, but maybe in the future we would be closer to you. But if you are in Maine and New Hampshire, we would love to see you. If you go to medmatrixusa.com, you can book a free discovery call. Thank you so much, Dr. Rose. Any final words of wisdom or, quote of the day or?
You're gonna get that out of me right now, but no, I just think it's a really important topic, probably under discussed.
Yeah, it's fun.
And as always, I appreciate learning from you and learning with you.
Same. Yeah, this is really fun. So tune in, like I said, next week and every week we're here talking all things functional medicine. So thank you very much, Dr. Rose. Thanks for all listening, and we'll see you on the next one. Bye-bye.
Bye-bye.